Welcome to The Better Life with Dr. Marianne Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Marianne Pinkston.
Hey there, everybody. Welcome to The Better Life with Dr. Marianne Pinkston. I am Marianne Pinkston, and I'm a family practitioner here in San Antonio, and I have the YouTube channel and radio show with San Antonio, but I'm also podcasted out to iTunes and all of the podcast platforms. But today, I usually have some guests. Sometimes I'll do it by myself, but today I have somebody who really means a lot to me, very personally, and this is John Pilcher from Sage Bariatric, but he is a bariatric surgeon here in San Antonio, Texas. And so you might wonder why I feel so strongly about having Dr. Pilcher on my show. It is because of obesity and the huge epidemic that we are facing. When you think COVID is something that everybody is worried about, but we have to go back and think about the things that are challenging us now, and obesity and inflammation, being overweight, diabetes, all of those factors are very, very huge. And I have the elite bariatric surgeon in my room with me today in the studio. So welcome. I'm so happy to have you.
Well, it's an honor to be here, Marianne. Thanks very much.
I am so thrilled to have you. So this is a huge subject. I mean, we probably could have 4 or 5 shows.
Huge, so to speak. Yeah.
Yeah, exactly. Right. No pun intended. But we absolutely have to face obesity, and we have to face it from, I think, a very different view. And when you and I were talking just before, you brought up a very important point about the discipline and the mindset behind how we face obesity today. And I would love for you to reiterate that and describe for me what you did.
Yeah, thank you. I think that society has been viewing obesity as something that's a personal matter, a personal choice. It's something that you're supposed to take care of on your own. A person is supposed to be able to control their weight through discipline and will and better habits. But to your point, that's really not the right way of looking at it. As information progresses, we understand more and more that this is actually a medical issue. It's a matter of biology imbalance. It's a matter of the energy hormones being out of balance. And it's not reasonable to think that an average human is going to control their weight just through will and focus. We don't ask that in terms of high blood pressure. We don't ask that in terms of diabetes. Obviously, these medical conditions do have a lifestyle component to their treatment plan, but also it's obviously appropriate to look for medical help in those conditions, and we should be thinking about obesity in the same way.
Absolutely. And many patients, when they come to me and talk to me about losing weight and they want to lose weight, they say they've been to previous physicians who just said, you need to do it. So here's a small little packet and plan and do it, and leave them to go off on their own. And I had to face that, losing weight as well. And that is not something that patients can do on their own all the time. There are a subset of people who have gained some weight, can just turn things around, watch what they eat, do okay. But there's a subset of people who have passed this point of no return, it seems, and who are unable to just do the things that they used to do to get the weight off. Their bodies have changed, right? Their bodies are different.
You're absolutely right. Just like any medical condition, there are stages of the disease process. And when it's at its early stage with a few pounds and the person is not very sick, then absolutely lifestyle intervention alone can be effective. But as the years pass, because the calendar is not always nice to us, as the years pass and the weight increases and the medical condition worsens, then the simpler interventions aren't as effective. We don't discard those interventions. We don't discard lifestyle, but we need to add more interventions. And so medicine can be useful. Minimal interventions can be useful. And then what I do, the major interventions, is applicable to a lot of people.
So for somebody, and I mentioned at the beginning, we're talking about bariatric surgery. So a lot of people may not know what bariatric surgery is. We are talking about weight loss surgery. So we're talking about things like gastric sleeve, gastric bypass, the switches, and things like that. So why is this intervention seen to most people as a cop out, as just a, you didn't work hard for it. You just went and had a surgery done and now you're okay. And that was the easy way out. Why do people see it that way?
Yeah, it's a really sensitive area for me because that's one of the things that makes me mad is when my patients are accused of taking the easy way out. It's not. It's a lot of work. It's risk. It takes courage to look ahead at what's going to happen over the next 5 or 10 years.
Yes, it does.
And to take on a big intervention with some risk. It's not huge, but to take on a big intervention with some risk now to make a better future. So the easy way out is absolutely not correct. And I'm not sure I completely understand, but I think where this comes from is this idea of ultimate personal responsibility for your weight, like we were talking about a minute ago.
Absolutely.
And so if you believe that, which I don't, but if you do believe that, then someone who is choosing to get help through medicines or surgery is cheating. And they really ought to just work harder. And that's, I think, is a misunderstanding of the actual condition.
Absolutely. Your body is out of your control at one point.
Yeah.
Your body is overinflamed. Your hormones are a mess. The fat tissue that you have is hormonally active by this point, and it's working completely against you. All of the things that you try to do to battle that work against you. And once you can lose 50 pounds, but you're going to gain back 70 because everything that you try to do turns on you. And it's just not an easy thing. Your body is not under your control anymore. So that is where the different surgeries and all the different types of surgeries, I'm sure, are very. Like I say, we could do this in 4 or 5 shows probably, and all the different types. But it really, in my mind, is given as a tool. Right. So this is part of your armament of what you're going to do to look forward and see yourself in the future as losing weight. This is a tool. It definitely is a jump start. It definitely helps you gain control of your body, get rid of a lot of that inflammatory component and whatnot. So I know that there are a lot of myths that keep people from making this decision. I think one of them is the fact that it's a cop out or an easy way out. Another one then is just the surgery. Is that you mentioned the risk of it. Right. It is a procedure. It is a surgery. But really, is it that giant of a risk? Is it something that people need to be afraid of?
Good question. And of course, as a surgeon, what we try to do when we meet a person thinking about surgery is we think about the risk-benefit consideration, the balance of risk versus benefit. And everyone is going to have some risk with a major surgical procedure when we go into the abdomen, when we go under full anesthesia. But what we're balancing against is the risk of the weight.
Thank you.
Yeah, it's not just the risk of surgery versus nothing in a normal life. It's the risk of surgery versus the weight. And actually, statistically and logically in research protocols, we find that the risk of the surgery is paid back in less than 6 months for essentially every patient. And so then the risk benefit in terms of the improved health, the extended longevity, the improved function comes, everything beyond 6 months is just gravy. And that's just how big of a risk the weight is. People don't realize.
That's incredible. What a statistic. I'm going to use that from now on because I talk a lot with my patients about bariatric surgery. And I don't talk to people who are just overweight. I talk to people who are significantly overweight. Right. And in that spiral, they've lost, they've gained, they've lost, they've gained. And so is this good for just anybody? Or is every patient that's just significantly overweight a type of person that needs to have this surgery?
That's a great question. And I think it's a combination of medical, statistical decision-making and personal decision-making as well. Medically, we would want someone who really has tried lifestyle interventions because that is a building block that we're going to put to work with the surgery.
Absolutely.
And then it needs to be someone who is healthy enough still to have surgery,
sure.
Which happily most people are. But this also brings in the idea that an earlier stage intervention is better than waiting until one's inured to death with the weight. That was the old tradition. We don't like that place. So there needs to be reasonable risk. And then people need to be kind of normally functional in their lives. There are, it's very uncommon, but there are some psychological conditions that would mean that surgery is not a good idea.
Sure.
And we're going to talk to people about that. But I would emphasize that's really uncommon, kind of the exception. So, so most people who are living normal lives, who are struggling with the weight and kind of losing the battle, would be reasonable to think about surgery.
So how do you, is is this something when that people want to have surgery, you just go see your doctor and then the next week you're in surgery? Or is there some prep work to it?
That's a great question, Marianne. And what you're leading into is, no, there's substantial preparation for this. And the preparation is on multiple different levels. We're going to make sure that a person is as healthy as they can be at their weight to get prepared for surgery. And there's a lot to that, particularly a liver shrinkage diet plan, which we may circle back to. That some people need cardiology testing, hematology testing. There's definitely an educational piece. We want them to understand how they are going to work with the surgery. We want that teaching to be in place, obviously, before the surgery happens. So that's ready to go when the surgery takes place. And there's a psychology piece that goes kind of beyond the education. It's looking at your own life and what. Not to say that a person has psychological problems, but having the obesity problem is a psychologically distorting factor in your life. So how has it affected you as an individual? How can we anticipate that's going to change after surgery? And let's get ready to adapt for that as well. And put the surgery to work, as you said very nicely, to put the surgery to work as an active tool for you over the years.
I know sometimes, patients who are overweight, and we assume that this is just a patient who has eaten their way to obesity. And a lot of times that's the beginning. There's an eating disorder component to it, or maybe an addiction to carbohydrates and eating. And, that's their tool to help them self-medicate, I guess, their life, when they're anxious and depressed and dealing with life is self-medicating. And so, a lot of times I know that there's got to be some coaching into helping patients understand that when they can't eat and they can't use that tool any longer, do they sometimes turn to other coping mechanisms like alcohol or things like that, drink their calories in? Or do you see a lot of that as well?
It's definitely there. I'm happy to say it's not a dominant issue, but it happens. And we call that addiction exchange. So there's this idea perhaps that they're addicted to food, or food is occupying time, or it's their friend or their stress release. And that's not true for everyone, by the way, but it's very common. And so that goes back to the psychological preparation you're asking about a minute ago. We want to make sure that they've got some tools to put this new time available into a more positive pathway. And this is not to say that food is going to be out of the picture. Food is, we don't demonize food. Food has important social and cultural significance, gatherings, love through food, connection through food. And these things are in Food Network, forgive me. So many people are foodies now. And all that is okay with bariatric surgery. People still can anticipate food and enjoy food. They're just going to approach it in a different way that I really believe is much more healthy.
It is much more healthy because you do not have to give up all of those pleasurable things about food. You just have to give up the pleasurable amount of it and the overabundance of what we do with our behaviors. And so, but I don't want people to see it as that I have to give up all of the pleasurable things about food. I hear that a lot when patients say, well, I don't think I'm ready for that yet because I'm not ready to give up food. No, you don't have to give up food. You just have to go back to some older thinking of I'm not going to eat as much and just, kind of downgrade on the overabundance of it. So if I've had patients also tell me that I'm too old. I've lived my life and I'm too old, and I've had some older patients come and have surgery. So how do you approach that?
I think if a person is at an age where they can still move around okay and they still have things that they want to do, whether that's travel or whether that's grandchildren or great-grandchildren, then those are people who we would like to talk to. We'll have a direct one-on-one conversation, and they may or may not be appropriate for surgery, but we'll be honest with them, and we're not going to increase their risk through unnecessary or inappropriate intervention.
One of my patients, I think I sent over, I don't think she saw you, but I sent over was almost 70. I think she was 69.
Great.
And she has a long life ahead of her. She was diabetic and had been diabetic, but she took care of herself reasonably, just very overweight, and her knees were going, and she couldn't be with her grandchildren. And so she went and did it. And oh my goodness, she's probably, she rocked it. And she probably acts like a 50-year-old now again and feels like it definitely. And I'm so proud of her for doing that. What a wonderful thing. I know another thing that people get hung up on as well is then the skin. The aftermath. So what happens when I lose all that weight? I'm going to have all this skin and I'm just going to be so, ugly and feel bad. And that is also a myth as well.
It's a big concern, and this is where I think extreme media is a little bit of a disservice. I think everybody has seen My 600-Pound Life, the TV show.
Exactly.
And I've met people who were in that category maybe 2 or 3 times in my career. That's actually really, really uncommon. And so, yes, people will have excess skin as the weight, the fat kind of melts away, but by no means is it going to be like My 600-Pound Life. And the vast majority of people are going to go to a place where in clothes, day in and day out, they're going to look A-okay, normal, and better. Great, because you're shopping off the normal rack at this stage and getting down to the size 10 and that kind of thing. But and without clothes, there may be some floppy areas. There's the belly, there's the butt, there's the boobs, if I can say that.
You can say that, because that is one of the areas that's big.
And so many patients can benefit from plastic surgery to tuck things back where they would like to be.
If you want to.
If you want to, exactly. But exactly where I was going, it's a personal choice. It's not, I think most people don't feel it's a necessity or an urgent issue after the weight loss.
Not as much as they think beforehand. Really what happens afterwards is very different as to what you think. So how long does it take for somebody, once they make the decision to do it, to actually get it done and go through the procedure, everything?
So if they've sat down with us and together, the surgeon, the patient, we agree this is the right idea. We have a little additional conversation on which surgery. There are kind of 2 parts to the process. The educational medical piece usually takes 2, 3, 4 weeks. Call it a month. The surgery schedule is usually not too booked out, and so that's a 2 or 3 week process. So you could meet us and have surgery at 4 to 6 weeks after we meet. The second part of the process, which often comes into it, is the insurance part of the process.
Absolutely, insurance is huge about it.
Yeah, and we want insurance coverage. Not everybody has insurance coverage, but we want that whenever it's available. All the insurance companies are going to have their set of hoops or criteria that a patient has to jump through. And the time that takes is tremendously variable. Sometimes that's just 2 weeks. And then sometimes insurance wants 6 months of being on
nutritional counseling.
In spite of the 10 years that you've done already, they want to say, okay, do that all over again.
Exactly.
And we as the docs are not in charge of the insurance companies.
That's right.
So we do have staff that research the insurance plan for each individual patient, free service before they even come in, because we want them to know what they were looking at. And so they'll know kind of what the insurance process looks like in their particular case.
Do you have an alternative if patients don't want to go through their insurance, if they want to do it private pay? Do you have an alternative plan that they could do?
Right. So if a patient happens just to not have insurance, or if they don't have the time for insurance, then yes, patients can pay out of pocket. We call that self-pay. And it's actually surprisingly efficient. It's down under $10,000 for the surgeon, for the hospital, for the anesthesia, and all that stuff. So I tell people it's a lot less than a Ford pickup truck.
Exactly. So, and this is the rest of your life. So that's incredible. Under $10,000. People can do that. They can usually find some ways of financing or things like that. That is amazing that you guys do that. So, wow. Well, I'm going to have some information on my website about where they can find Sage. And Sage is San Antonio. Help me.
It should stand for something, but no, we just wanted to pick the kind of wisdom and the health aspect. So it's more of a vibe than an actual acronym.
I've spent the last 5 years trying to figure that out. I never once even looked it up, which is so sad. So that's amazing. Well, you can find all this information I'm going to have on my website, drpbetterlife.com, as well as all of the links to YouTube and all of the platforms for podcasting, so you can find this information and find Dr. Pilcher and what he's up to these days. And so we're going to take a short break. When we come back, I've got a few more questions. I wish I had you for, several shows. I just love having you here, but we'll be back in just a few minutes.
Fatty liver is linked to 2 different situations, alcohol and diabetes, or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and/or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
there. I'm Dr. Marianne Pinkston, and I am back with John Pilcher today, Dr. John Pilcher today from Sage Bariatric. And we've been talking about bariatric or weight loss surgery, and we've had so many great points. But I know that there are a lot of people, we talk to probably think about, like you said, people childbearing age who are interested in losing weight, but they're concerned about, can I get pregnant? What happens to my ability to get pregnant? Things like that. So I'd like you to remark about that.
Thank you. Yeah. So it's a great subset of patients to meet, the younger people who are still at the early stages of the disease, where there's not damage from the weight at this point, but they're still at the stage of their life where they may want to have some kids. And so they have appropriate questions about what happens. Can I get pregnant after surgery? Is it okay to be pregnant after surgery? What about the delivery? What about C-section versus normal vaginal delivery? And actually, the story is really positive. So first of all, the chances of becoming pregnant, fertility normalizes, which is to say it improves as the weight comes down. And then an even bigger factor is that to be a mom with obesity is a risk factor for both mom and the baby. And babies are affected actually throughout their life if mom is obese during the pregnancy. And so it's not just
epigenetic. Obesity is epigenetic.
Yes, so. Epigenetic. That's exactly right. And so it's one of the great examples of epigenetics. It's not just a nice idea, but it's been statistically shown that moms who have babies after bariatric surgery have a safer pregnancy, avoiding preeclampsia and things like that.
Absolutely.
And the babies have better outcomes through their life, not just right after delivery, but through their life, because mom went into the pregnancy at a lower, healthier weight. And both the sleeve and the bypass, which are the common operations, are safe for pregnancy. It's the kind of thing where we want to connect with the obstetrician. And there's a few little details, but they're all pretty much as positive.
But it can be done, which
Absolutely.
is the deal. So,
and it's a great story. Oh, and in my own patient, because I've been doing this for a while, in my own patient population, we're up to about 122 babies.
Oh my gosh.
Born to my patients. And that's one of the most fun things that we do.
Yeah. Oh, see, that is truly a gift. That's a gift that you're giving to people, is a gift of life. I mean, when you turn around and get your life back after being so obese for so long, that is an absolute true gift. So you do wonderful work.
That's a pleasure.
And I applaud you. Absolutely. So we were talking also about energy balance, and I'd love for you to open that subject a little bit.
Thank you. Yeah, I want to circle back. You earlier in the session, you said that the body is out of your control.
Absolutely.
And that is completely consistent with what science is showing us. Yes. And so the concept is, and this is going to circle back to surgery piece, but the concept is that the body has a survival system for fat storage, which makes sense because if you're in the caveman days, you don't get to eat all the time.
Right.
You need a way to carry through those lean times or those famine times, and that's the fat storage system. So it is a survival system, just like blood pressure monitoring, just like breathing, just like temperature and things like this. It works on a different time scale, but it's absolutely true to say this is not under your control. And it's an interesting thing. Some of our vital functions, like breathing, we can affect these things if we choose to really focus on them for a little while. So everybody can hold their breath for a few minutes. Sure. But you know that you start breathing on your own again, and pretty soon you forget about it. Right. And so it's demonstrating that these vital systems are not in your control. And the weight thing is the same. The weight thing is something that you can modify how it functions for a certain time period with will. Right. And this will last over weeks or months, and you lose 20 or 30 pounds.
Absolutely.
And it's tricky because it looks like, okay, we'll just keep doing that. But it's just like holding your breath. The longer you do this thing that's different than what your body wants to do, the more it hurts.
Right.
And the harder it becomes. And so, and people blame themselves because that's what society tells them. Society says, well, just keep doing it. But no, it's harder and harder and harder the more you do it. And so then the body will rebound. And so this control system, we call it a set point. The body has a certain weight level that it thinks is healthy, whether that actually makes sense or not. In many cases, it doesn't make sense, but it's real.
It's real.
And that set point tends to migrate up over time so that people feel like they're out of control. Now, going back to the surgery piece. So when you look at the diagrams of the surgical procedures, they look like they just make a smaller stomach, and you would intuitively think, okay, I can't hold as much food.
Right?
Yeah.
Yep.
And that is a factor, but the bigger factor and the more important, more lasting factor is that the operations actually have a positive impact on this energy balance and reduce the set point to a lower level. So it's no longer the person trying to eat less and fighting against their body, but it's the body and the patient working together. They both agree, we don't need as much food because we changed the set point. Right. And so the weight kind of comes off in that way. And that's what makes it kind of lasting, sustainable, and comfortable to last over time.
Exactly. It's so important, because that's where I see patients. There are some people I can say, you can lose a little bit, weight and work and just change your diet and that'll come off, exercise, whatever. But there are those people that go past that and can't, no matter what they do. And they will drop that 20, like you say, against their body's will. And then it'll jump up 40 then. And they just keep going until they're, like I did, up to 300 pounds. And so, it is out of your control at some point. And this is something that is a tool that is very helpful for the body to turn things around. I mean, patients leave their diabetes medicines behind? Do they leave some of their diseases behind once they get the surgery?
Yes. So as you can imagine, the obesity affects pretty much every body system. It's the metabolism with diabetes and blood pressure and cholesterol and heart disease. It's also the joints. It's also the skin, inflammatory diseases, lupus and rheumatoid issues. And the obesity upregulates the inflammatory system. It affects the immune system. I mean, it's a hot topic these days.
But COVID
obesity interferes with proper immune function. And so bringing the weight down, and yes, with surgery, bringing the weight down affects all those things in a positive way. And so, when I meet someone, like you mentioned, your 70-year-old lady, lovely woman, is probably on 14 medicines before surgery, and we can get her down to 4 medicines. We don't get them all gone, but we markedly reduce that. Even better is if we go back to our 25-year-old woman who's not on meds yet, we keep her off of medicines until she gets to, one medicine at the age of 59 or something like that a lot later, rather than staring 4 medicines in the face over the next 2 or 3 years.
Which is extremely reasonable. It's, if you get older, you have some diseases, these things develop, you have to take some things, but 14 medicines, based on the body being obese is just something, if we can turn that around and bring health back to people, is absolutely amazing. It is never too late. It's never too late to take control of your life. And bariatric surgery is a wonderful tool, and it's too bad there's such a stigma out there. I hope that we have turned some of those stigmas around, because it really is not an easy way out at all. It is something that patients really do have to work at, but they work in conjunction with our provider and their, and even through me, family practitioner. It's a team effort. And for patients who make that decision, they go in and talk, and they can be on the surgery. I remember you told me this, because I did have bariatric surgery, and that's why I wanted you to come on and talk to people today. I didn't want it to be about me, though, and anybody has questions are welcome to ask me about it. But as you told me, it's like at any point you can change your mind. If you don't want to do it, you don't have to do it. You're not locked in. So I think the fear is, if I decide, what if I change my mind? You can, but you shouldn't. It is a wonderful process, and it is a great adventure to go on with somebody that you trust, this is who I trusted, and it did a great job for me. So thank you. I appreciate it. So we did it. We did it in the last 7 minutes. It's gone, and it's so fast. I wish we had 3 or 4 more shows to talk about this. This is a very, very important subject, but thank all of you. You can go to my site at drpbetterlife.com, and you can reach all of those platforms, podcast, YouTube, where you can listen to this, and hopefully it'll help some people make some good decisions, about their health. And I appreciate you so much coming on today.